There is a daily habit, one thing that 89% of people over 60 are doing without thinking. That is exactly what triggers silent strokes from 2 a.m. to 6 a.m., the time when your body is at its weakest. In 2019, a leaked internal record from one of the largest pharmaceutical corporations in the world revealed a truth that made me extremely furious. Their own researchers discovered that this habit is directly linked to more than 340,000 deaths from stroke and heart attacks every year in older adults. That is 932 preventable deaths every day. Today, I will share 7 nighttime habits that are triggering strokes while you sleep, and simple changes starting tonight that clinical studies show can reduce the risk of an overnight stroke by 67%. Before we begin, if you believe older adults deserve to know the truth, subscribe right now and turn on notifications. Only those who benefit from your suffering do not want you to subscribe. If you are tired of being deceived, tired of taking more medications with many side effects, tired of living in fear of chest pain that could end everything, subscribe now and leave a comment telling me your age and where you are watching from. First, let us talk about habit number 7, something your doctor is probably doing too, but they will never mention it during your appointment. It is taking blood pressure medication at the wrong time of day. Right now, if you are taking blood pressure medication, and 74% of people over 65 are, you are probably taking it in the morning with breakfast. That is what your doctor told you, that is what is printed on the label, and that is what everyone does, and that is what is killing us. Here is what they do not tell you. Your blood pressure runs on a 24-hour biological rhythm. It drops while you sleep, a phenomenon called nocturnal dipping, and then it begins to surge ruthlessly from 3 a.m. to 6 a.m. In healthy people, this rise happens smoothly, but in older adults with high blood pressure, especially over 70, this rise turns into a pressure shock. A dangerous shock that can rupture weakened vessel walls, dislodge plaque buildup, and trigger silent strokes or heart attacks while you are still unconscious. The pill you take in the morning starts wearing off from midnight and is completely out of your system at 2 a.m., right before the deadly window hits. You have no protection at the exact hours when strokes are most likely to happen. A shocking 2019 study called the Hygia Chronotherapy Trial, published in the European Heart Journal, followed 19,084 older adults for 6.3 years. They divided participants into 2 groups. Group 1 took medication in the morning in the usual way. Group 2 took the same medication at the same dose, but at bedtime. The results were astonishing. The bedtime group reduced cardiovascular events by 45%, but the most stunning number is this. Their risk of death from stroke and heart attack dropped by as much as 66%. Just changing the time you take the medication cut the risk of death by more than half. When this study was published, it should have been on the front page of every newspaper. Every cardiologist should have called their patients immediately, but that did not happen. Why? Because there is no money in telling you to take the same pill at a different time. They cannot patent taking medication at bedtime. So this information quietly sat inside medical journals that 99% of patients will never read. Habit number 6 is so common that 93% of older adults do it every day, and it is silently creating tiny blood clots in your arteries right now. Picture this. It is 6 p.m. You just finished dinner. You sit down in your favorite armchair to watch the news or a movie. You sit there continuously for 3 hours, sometimes 4 or 5 hours, before slowly walking into the bedroom at 10 or 11 at night. That sounds normal, right? But here's what is really happening inside your body. When you sit still for a long time, blood flow in your legs slows by up to 50%. Science calls this venous stasis, and it is one of the main drivers of clot formation. Our blood is meant to circulate. When it pools in the legs, platelets start sticking together. Small clots form. In younger people, the body can dissolve them. But in people over 70, especially those with a history of cardiovascular disease or diabetes, these clots do not disappear. They sit there and silently grow larger. And then, the moment you stand up to go to bed, your blood pressure changes suddenly and those clots break loose. They move through the veins, rushing straight to the heart and the brain. They can block a coronary artery or trigger a heart rhythm disorder that leads to death, all while you are brushing your teeth, without realizing that the last 4 hours of sitting and watching TV just set off a biological time bomb. A study from the American Heart Association analyzed 8,028 older adults and delivered a chilling result. People who sit more than 10 hours a day have a 34% higher risk of heart attack and stroke. But the key point is not total sitting time, it is uninterrupted sitting time. Sitting for 4 straight hours before bed is far more dangerous than sitting for 6 hours with breaks every 30 minutes. Why? Because even a short movement, like standing up to get water, is enough to restore blood flow and prevent blood clots from forming. Habit number 5 involves something you put into your body every night, something labeled as good for your health, but in reality, it is a slow-motion blood pressure bomb at 3 a.m. Sitting still is an external danger, but habit number 5 is destruction from inside your body. You are putting something into your body that food corporations label as good for your health, but it is actually creating the perfect environment for overnight heart attacks. It is consuming high-sodium meals within 3 hours before bedtime. I want to ask you something. What did you eat for dinner last night? A convenient frozen meal, a bowl of canned soup, or some takeout from a restaurant? If the answer is yes, you may have consumed 2,000 to 4,000 milligrams of sodium in a single meal. That number is far above the recommended amount for an entire day. And if you ate it after 6 p.m., here is what is happening inside your blood vessels. Sodium is like a magnet for water. When you take in too much salt, your body has to retain a massive amount of fluid to dilute it. This excess fluid floods into your bloodstream, increasing pressure on your circulatory system. Your blood pressure can jump by 20 or 30 points within 2 hours after eating. The real danger appears when you lie down. At that point, gravity is no longer helping distribute that fluid. It begins pooling toward your chest cavity, surrounding your heart. Your heart has to work harder to pump blood against the rising pressure while you are completely unaware because you are asleep. The peak of this blood pressure surge usually happens between 2 a.m. and 4 a.m., the deadly window when most heart attacks occur. A study in the Journal of the American Heart Association with nearly 3,000 older adults found that people who eat high sodium close to bedtime have a 3.2 times higher rate of early morning cardiovascular events. Why does the food industry hide this? Because salt is addictive. It makes you eat more and buy more. They put the label heart healthy on frozen meals just because they are low fat. But they ignore the harmful salt inside because the law does not require sodium warnings to be displayed prominently. Habit number 4 is even more brutal. It is the deadly combination of a common drink and sleeping pills, something that can make your heart stop forever without causing any pain as a warning. If eating habits are slow poisoning, then habit number 4 is like playing Russian roulette with your own heart. I am talking about drinking alcohol combined with sleeping pills, or simply drinking alcohol within 3 hours before bedtime. Picture this. It is 8 p.m. After a stressful day, you treat yourself to 1 or 2 glasses of wine to relax. By 10 p.m., you take a prescription sleeping pill or an over-the-counter sleep aid because you think the alcohol was not enough to help you sleep deeply. You fall asleep at 11 p.m. feeling peaceful, but in reality, you just created a deadly chemical laboratory inside your chest. Alcohol is a cardiovascular depressant. In the first 3 hours, it slows your heart rate and lowers your blood pressure. But the real trouble starts after that. About 4 to 6 hours after your last drink, your body has an extremely intense rebound reaction. Your sympathetic nervous system becomes overstimulated, and your heart rate and blood pressure surge suddenly by as much as 40 points, right in the middle of the night. When you add the effects of sleeping pills to this scenario, disaster happens. Sleeping pills paralyze the brain's protective mechanisms. Normally, if your heart rhythm becomes abnormal, the brain detects it and corrects it right away. But sleeping pills blunt that warning system. The result is that your heart starts beating in a chaotic, irregular rhythm while you are completely unconscious. A 2021 study in the European Heart Journal reported that people who combine these two have a cardiovascular death risk that spikes by as much as 73%. Why do drug companies not warn about this clearly? Because if they printed "the words can cause sudden death" when combined with alcohol right on the bottle label instead of hiding it in tiny inserts, their sales would drop by billions of dollars. They would rather let you face the risk than trade profit. Okay, let us talk about habit number 3. A simple but devastating mistake that I bet you are making every day because you are afraid of waking up to use the bathroom at night. It is going to bed when your body is severely dehydrated. I understand how you feel. After 60, having to wake up 2 or 3 times every night to go to the bathroom is torture. So you choose to stop drinking water after 6 p.m. But here is the price your blood vessels pay. Our blood is up to 92% water. When you are dehydrated, that percentage drops, and your blood no longer flows smoothly like water. It becomes thick and sticky like honey. During the 6 to 8 hours you sleep without a single drop of water going into your body, that thick blood has to squeeze through arteries that are already narrowed by plaque buildup. Your heart has to work twice as hard, 3 times as hard, to push that honey through to nourish your body. And when the natural early morning blood pressure surge hits, blood clots form more easily than ever in that concentrated blood. A study in the American Journal of Epidemiology followed more than 20,000 older adults and found that people who go to bed dehydrated have a 43% higher risk of heart attack and a 52% higher risk of stroke compared with those who drink enough water. You are protecting your sleep from bathroom trips, but you are leaving your heart to face death. Now, habit number 2 is something you do every night just because it feels comfortable, but it is directly cutting off blood circulation to your brain and heart for 6 to 8 straight hours. It is sleeping on your right side or sleeping face down. Think back to how you slept last night. If you slept on your right side or on your stomach, you are forcing the largest blood vessels in your body to work under tremendous pressure. Let me explain the physics. The human heart sits slightly to the left side of the chest. When you sleep on your right side, the weight of your entire body and your internal organs presses down on your heart, pinning it against the chest wall. This compression reduces the volume of blood your heart can hold with each beat, forcing it to strain 23% harder just to keep you alive. And there is more. The inferior vena cava, the main pathway that brings blood from the lower body back to the heart, runs along the right side of your spine. When you sleep on your right side, you are squeezing that very pathway. Blood cannot return to the heart smoothly, causing the heart to beat faster and harder at the exact time it needs rest the most. For someone over 60 with an aging cardiovascular system, this strain is the line between waking up healthy and a sudden cardiac arrest. And what about sleeping face down? That is a disaster for the brain. When you sleep on your stomach, you have to turn your neck to one side to breathe. That twisting compresses the carotid arteries and the vertebral arteries, the most critical pipelines that deliver oxygen to the brain. Ultrasound studies show that turning the neck more than 45 degrees reduces blood flow to the brain by as much as 42%. You spend the whole night starving your brain and then wonder why you wake up dizzy, sluggish, and with a headache. A study of 1,000 older adults with cardiovascular disease found that people who sleep on their right side have a 29% higher rate of arrhythmias and a 41% higher rate of overnight high blood pressure, compared with those who sleep on their left side. Sleeping on your left side is not just a preference. It is a position that lets gravity support your heart in the gentlest way. But do doctors ever tell you this? No, because advice about sleep position does not make money. This is it. The most devastating habit, the one that has taken the lives of more older adults in their sleep than any factor I have mentioned. The scary part is that it is happening because doctors are still prescribing these medications and telling you to take them before bed without giving a single warning about the catastrophic cardiovascular risk. I am talking about using medications with anticholinergic effects right before sleep. These include older generation antihistamines, such as Benadryl, sedatives, certain antidepressants, and even pain relievers labeled PM. Here is the brutal truth about what these medications do to your operating system. They block acetylcholine, a neurotransmitter that is extremely important for regulating heart rhythm and blood pressure. When you block it at night, your heart's autopilot system becomes paralyzed. In the early morning, when your body releases a large amount of stress hormones like cortisol to prepare to wake up, your heart needs to increase its rate to respond. But because of the medication, the heart cannot receive the signals to coordinate its rhythm accurately. The result is that your heart falls into chaotic arrhythmias, ventricular fibrillation, and finally stops beating. You are unconscious because of the drug, so you do not even feel pain. You cannot call for help. You simply stop breathing in a false quiet. A study in JAMA Internal Medicine analyzed 10,000 cases of sudden cardiac death in people over 65. The results were horrifying. 58% of the victims had used at least one medication with strong anticholinergic effects within 4 hours before death. Even more outrageous, 73% of those deaths occurred between 2 a.m. and 6 a.m. Drug companies know this well, but they choose to bury the risk in tiny print that no one reads. Why? Because if they warned that this medication can make your heart stop while you sleep, the billions of dollars in revenue from sleep aid products would evaporate immediately. You are facing two choices. Choice 1. You turn off this video, keep your old habits, and gamble your life every early morning. Choice 2. You take back control of your health right now. Based on the Hygia research, if you are taking blood pressure medication, discuss with your doctor switching to taking it at bedtime to get 24-hour protection and reduce the risk of death by 66%. Set an alarm to stand up every 30 minutes while watching TV. Never go to bed thirsty. Train yourself to sleep on your left side to support your heart. And most importantly, check your medicine cabinet and remove older generation antihistamines before sleep. If this video is helpful to you, subscribe to the channel right now. In the next video, I will reveal 5 breakfast foods that you think are good, but are actually triggering silent strokes just hours after you eat them. Remember, knowledge is a weapon, and your health is.